Post-traumatic stress disorder, also called PTSD, is a mental health problem that develops after experiencing a traumatic event, which causes recurrent mental and physical stress. It is important to have an understanding of what a person is going through that has this disorder. Knowing the symptoms and what to expect can help a person's treatment plan in the long run. PTSD can affect children, teens, women, and men. It is most common with military personnel and veterans. The following video shows the emotions and thoughts that people with PTSD are going through.
I have PTSD from serving my country. All I want to do is go back to Iraq to feel normal again.
I have PTSD from sexual assault trauma, and I'm worried that because of it, I won't ever be able to have a normal relationship.
I have PTSD and have nightmares every night, so I avoid sleeping as much as possible.
Today I was diagnosed with PTSD. Now I'm feeling more anxious and depressed about it. I'm not looking forward to the stigma that comes along with it.
I live with PTSD from Iraq every day. Nobody knows, they just think I'm antisocial, boring, and a bit strange.
I can't keep a relationship going because of my PTSD. There's gotta be a girl out there who's willing to look past it for me.
I have PTSD, and when people find out, they ask where I served. When I tell them I wasn't in the military, they dismiss it like I'm lying.
I have severe PTSD, but I'm afraid to get the diagnosis. I don't want a label, a handout, or sympathy. I just want help.
I secretly live with post-traumatic stress disorder.
According to the Diagnostic and Statistical Manual for Mental Disorders 5th edition, also known as the DSM-5, categorizes PTSD as a trauma and stressor-related disorder, which happens when an acute stress response continues for over a month. Some of the main symptoms of PTSD are psychological. For example, someone may re-experience their traumatic event through nightmares, flashbacks, and intrusive thoughts, which can lead to behavioral changes. They will feel a sense as if they are always on guard and will always be startled by the smallest noises or things that will trigger a response. PTSD can lead to sleeping problems, anger issues, substance abuse, and sadly, suicide. PTSD affects anyone at any age. For example, children can be affected by witnessing domestic violence in the home or by being abused. Children with PTSD often do not show any symptoms, but instead they will act out scenes that are troubling them in regards to their traumatic event. People that go through extreme trauma as a child are more likely to develop PTSD in response to other traumas that they face as an adult. According to Dr. Martin Deal, psychiatrist, he states, while drug treatment can't provide the whole answer to PTSD, it can relieve some of the disabling symptoms so that patients respond better to psychological therapy and counseling. Treatment for a person with PTSD is often complicated as they are reluctant to engage with the trauma in any way. Treatment options for people with PTSD are psychotherapy, medications, or a combination of the two. Everyone is different, so a treatment that works for one person may not work for another person. Some people may need to try different treatments to find out what works best for their symptoms. Research has shown that exposure therapy, which slowly exposes the individual to the situations that trigger their trauma, can be very effective. Group therapy is also another good form of treatment because they are around others that can understand what they are experiencing. And lastly, medications such as anti-anxiety medications, sleep aids, and antidepressants can help reduce depressive symptoms that accompany the PTSD, which can help eliminate the flashbacks and nightmares and can help a person sleep better. In addition, a person with PTSD will self-medicate by turning to alcohol or drugs, which can worsen their symptoms. A treatment plan for a person with PTSD is important to help alleviate their symptoms while safely managing substance abuse issues. PTSD happens after a violent trauma and involves recurring thoughts that persist for more than a month. PTSD can be managed with effective coping strategies and medications. It is important to know what to expect in a person with PTSD so that they can get the proper help.